Today, I'll talk about group CBT. Although there are some features that are unique to group CBT, as you listen to today's lecture, you will realize that there are many similarities between individual and group CBT. Many skills that you learned so far in class, skills that are used to address negative cognitions in individual CBT sessions can be effectively facilitated in the group settings as well. Although many CBT groups are focused on a variety of different activities, I encourage you to learn more about cognitive interventions that can be used in CBT groups, which differentiate CBT groups from other more activity-oriented group therapies. So let's begin. First, let's talk about the benefits of group CBT. First of all, group settings can offer the opportunities for positive peer modeling. And because multiple people can try out the same skills within one session, skills can be reinforced through repetitions. Also, there are additional therapeutic effects that can be gained through social support that are received by other members of the group. There are also some practical benefits, such as cost effectiveness, since group therapy is often charged at a cheaper rate than an individual session. And because one therapist can serve multiple people with similar issues at the same time, group therapy can be a partial solution that can address the issue of limited availability of CBT therapists. Finally, because therapists can see multiple patients at the same time and get paid by each member of the group, that can mean increased revenue for some therapists working in certain settings, such as private or group practice. There are different types of group CBT based on the target symptoms and group composition. In terms of target symptoms, diagnostic specific groups focus on one specific mental health condition. As you heard about CBT groups for depression, CBT groups for anxiety or trauma, etc. There are also transdiagnostic groups that target some shared characteristics of multiple mental health conditions. This is possible because, as you know, CBT focuses on negative cognitions, which are relevant to many different mental health diagnoses. Based on group composition, CBT can be offered as couples therapy, family therapy, and as regular group therapy. Active ingredient in group CBT refers to core processes that takes place in group setting that makes the process therapeutic. So Yalom, in his classic book about group therapy, wrote about these curative factors. So these curative factors are also relevant to group CBT. So first of all, the universality refers to group members having this shared experience and feelings, and then they realize that the challenges and difficulties that they go through are not unique to them. So they feel less isolated and more validated. Altruism is that in a group setting, members have a chance to help each other. So that can increase their self-esteem and improve their interpersonal skills. Insulation of hope refers to group members being encouraged by hearing about other members who've gone through similar experiences in life. Imparting information is the fact that members in group setting, they share the information that they know. So they learn helpful facts about problems, solutions, and treatment services from other people. And correct recapitulation of the primary family experience means is that a lot of people they grow up watching how their parents and close other family members behave, so that becomes their behavioral model. But by being exposed to group setting, people learn that there are different ways of behaving, so they get to learn these new and healthier ways to interact with other people. Continuing on, because members in the group are exposed to different perspectives, they can think about their past from multiple different perspectives, and then interpret what happened in light of how it's affecting their current functioning and the quality of their lives, and therefore think about how they can take responsibility for their present and future. Um, and because in a group setting, members have a chance to disclose some significant events that they have been shared with anyone, or emotional distress associated with those significant events, they can experience catharsis and gain a sense of relief. And also, group setting is a great place where members can learn from each other by interacting with each other. And then also, because they are observed by other people, they also gets to observe how other people behave differently. They can develop more improved self-understanding. Apparently, group setting is a great place where people can develop social skills by practicing new ways of thinking and behaving in a safe and supportive environment. And people get to imitate other people, and therefore learn through modeling and group cohesiveness, and a sense of belonging to the group can be an important curative factors. In addition to the therapeutic factors that are generic to group therapy settings, there are some aspects of group therapy that can specifically enhance therapy processes in CBT, which are relevant to the core CBT model and core principles of CBT. For example, one of the CBT techniques that you learned in class is behavior experiment, which is used to test out clients' thoughts and assumptions through experiment. Therapists gently challenge clients' beliefs by sharing their observation during the experiment. In the group setting, other members can also contribute to this process of cognitive restructuring by sharing their observations. Another CBT-specific active ingredient is normalization, which is similar to the concept of universality suggested by Yalom, as we previously discussed. Normalization is specifically important in CBT because, as you know, a lot of clients with depression and anxiety have a tendency to catastrophize their situations. By hearing from other group members who are going through similar experiences, clients can learn to decatastrophize their situations, thinking that the experience that they're having is not really unique to them. Collaborative therapeutic relationship, as you learned previously, is one of the core principles of CBT. And this collaborative process can expand beyond the dyad between therapist and client, as other group members actively contribute to the collective processes of group therapy in CBT. In vivo exposure is one of the common components of CBT for treating anxiety. Group settings can naturally recreate clients' feared situations for dealing with anxiety and avoidance, so that they can be desensitized to those feared situations. Lastly, problem solving is another central skill that is taught in CBT. As a member of a group, talk about their problems. Other group members can share multiple solutions and opportunities to practice those solutions in a supportive environment through which clients can experience a sense of mastery. The broad aims of CBT group therapy is very similar to the individual CBT sessions. So first of all, you want to increase clients' understanding of their own patterns of thinking and patterns of acting, and their responses to activating situations. They also want to identify and reduce unhelpful thoughts and behaviors. Reduce distress, always symptom reduction is one of the core goal of CBT. Also learning skills that can be transferred to the real life situations, and also building coping skills for your clients. Among the possible formats for group CBT, one that is often used is psychoeducation group, which I'm sure that a lot of you are familiar with. So it's taken traditional didactic teaching style. So the focus is on large volume and low contact. So you can have a lot of participants, but there will be limited opportunities for you to have individual contact with all the group members. The potential benefits of this type of group is reducing stigma because going to a preventive mental health class is often more acceptable than going to maybe professional therapy sessions. And people can just self-refer to those type of group. So a lot of people use this format for ethnic and racial minority population who may not actually seek a professional help when they are going through some mental health difficulties. Other format, it's more of traditional like small group setting, typically weekly 1 hour setting. I assume that a lot of you have done something like this in your field agency. So your group therapy can be open, which means that anyone who's on the ward, if you're in a psychiatric ward, anyone who's in the ward can choose to come to the session, or it can be closed, which is just for a designated member of the group. So structuring CBT group, by no means this is the only way that you can structure CBT group therapy, but this is just kind of general guidelines that how you would set up small group type of CBT group. So, as in other types of CBT sessions, there is a beginning, middle, and end because CBT is in nature is very structured. So your group therapy is going to be as structured or actually more structured than individual CBT sessions. So you want to typically start with introduction, therapist introduction. The groups can introduce themselves. If there are new members, you want to make sure that each of the new members have a chance to introduce themselves. And then you want to announce rules. Hopefully you have established some rules through a collaborative manner in the beginning of therapy. So you want to talk about confidentiality, how like things that are shared in this group stays in the group, and then kind of emphasize the importance of reducing interruptions, like turning off cell phone, and just listening,
and not interrupting when other people are talking. And then what are some of the etiquettes of leaving the group when they have to leave in the middle of the therapy? So these are some of the things that you want to talk about openly in the beginning of therapy. And then for each session, you want to remind your group members about those rules. And then you can briefly receive some feedback from the previous session. If you assign the homework, this is where you want to briefly go over and review the homework. So typically you want to allocate just about 5 minutes to this beginning part of the group therapy. So when you get to the middle part of CBT group, um, which can typically last between 35 to 40 minutes, um, you want to decide a topic unless you already decided a topic before you ended the session in the previous week by asking like, what is it that you have that you would like to bring to the group today? Um, and then you want to have one group member, or it could be several group members, talk about the issues that they had recently. So that's a problem description. You want to identify and describe a recent problematic situation using the ABC model. So depending on the phase of therapy, how, if it's initial phase, clients might not really know a lot about the ABC model. So if your clients share these activating situation or problems that they encountered, you want to work with the entire group to kind of lay it out according to the ABC model. So this is what happened, and this was my thought in the moment. And because of that, I felt this way, and because of that, I acted this way, and the consequences of the action or of that kind of thinking was this. So this is something that you want to exercise with your group members repeatedly. Um, and then when one of the group members shares their experience, other group members can share their perspectives, um, to identify healthier alternative responses.
So if the group members know each other and have built some level of trust with other members as well as with you, the therapist, it is okay to start a group session with collaboratively deciding the topics to focus on and engaging members in open discussions as I just described. And then you can move on to the second part of the middle section where you introduce skills and techniques. Um, but in the beginning phase of group therapy, it might actually make more sense to go straight to the second part because the members might not know each other and may not feel safe to just jump into open discussions. And they don't really know a lot of skills that they can apply to the specific problems that are identified by other group members. So it is okay to, give a little more structure in the beginning phase of group therapy until group members develop some level of trust and then know the routine and learn more skills that they can apply. Um, so in the skills sections, you can either reinforce the skills that you introduced in previous sessions by repetition or teach new skills. And a lot of skills that you can use in the group setting involve the same process of identifying and eliciting negative thoughts and evaluating and modifying those thoughts into more helpful and adaptive thoughts. When facilitating these skills in the group setting, it is helpful to package the intervention in a way that can facilitate group interactions by incorporating different kind of activities while teaching the core skills. Um, so now I want you to pause this lecture video and click the link I posted under the supplemental video and watch the short videos that are provided in that link. So these short videos are great examples of how you can use different kind of activities to teach the core CBT skills of addressing negative cognitions in more activity incorporated ways in group settings. Some of them incorporate mindfulness-based interventions, which you learn more about later in the semester, but most of them do involve the core process of identifying, eliciting, evaluating, and modifying negative cognitions.
When you get to the end of CBT group, what you will do will be pretty similar to what you would do in the individual CBT session. First, you want to summarize what you did, summarize the topics that you discussed, and then skills that you learned. And you want to ask for feedback, making sure that clients have a chance to share their own perspectives about how things went. If there's a homework, you want to assign homework now. And at the very end, it's always helpful to establish some kind of ritual, like ending ritual. Maybe you end the session by giving out inspiring quotes or handing out like index size coping cards or doing a brief mindful breathing exercise before you end. All this ending ritual will give a sense of closure for your clients. There are several things that you want to consider when running a CBT group. First of all, there are structural factors that you might want to consider. How big your group should be, how many members you should have in your group. Whether you're going to have co-therapists or not, that depends on how many people you have. Typically, it's helpful to have co-therapists because you have limited attention that you can give to a certain number of people. There are also some client factors that you want to consider because some people may not be really best to put in a group setting. And these are things that you will discuss with your supervisor, like who will, I mean, if it's a closed group, who will be a good match for what type of group. For example, those who are having some communication issues that might seriously interfere with the group interaction might not be really good candidate for group therapy. Plus, those who are having some issues with aggression or dissociation or active suicidal ideation, um, it may be difficult to facilitate group a process with those people and as part of the group. There's also people with personality traits like who's extremely competitive or has tendency to dominate. I mean, of course, people bring in all kinds of personality issues, but you know, when people have some clinical like personality disorder type of issues, they actually might not be the best kind of match for certain kind of groups that you're running. Those who have fear of group environment or those just who don't like to be in a group. I've seen a lot of people who refuse to be in a group and then require some persuasion because, you know, as a therapist, like you think that there would be some benefits for certain clients to be in a group, but you know, like they keep refusing, you can't really do much about that unless, you know, they are mandated to be a part of the group therapy. So these are some of the client factors that you want to consider in running groups.
Okay, that completes today's lecture. You will have a chance to watch Dr. Dutilio facilitating family therapy. So please watch the video, respond to the reflection questions, and that's your assignment this week. When you come back for a Zoom live session, we'll talk more about group CBT skills. So have a great week, and I'll see you next week. Bye.